Hi there, and thank you for your patience last week when we were not able to do a video. We trust that it's going to have been worth the wait. Before we settle into this series on arthritis, just a reminder to please push the thumbs up button if you have liked this video, and if you are not yet subscribed, to click on the subscribe button and the notification bell so that you won't miss any further episodes. You'll also be able to see anything that's gone before. So, this topic, arthritis, affects people of every age. But when the topic is first brought up, the first thing that enters most people's mind is that it's an old people's disease. Well, only one of the many types of arthritis usually affects older people, and that is osteoarthritis. This is mainly due to wear and tear and injury, and I think it's faultless to say 90% of people will get it at some stage of their life. So what is arthritis? Arthritis is the inflammation of one or more joints. It is usually accompanied by pain and stiffness, usually in the morning or after exercise, as well as possible deformity. You'll see the fingers start going to the sides. Very often the knuckles also get pushed out of joint. Knees get very knobbly, and the spine can start curving. Bone growths or spurs may develop in the affected joints, increasing pain and decreasing mobility. And a friend of mine has a spur in one of her neck vertebra, and so her range of motion, when she turns her neck on the one side, she has a click that happens, and then with that click comes the pain, and that's from the bone spur. So it definitely has affected her range of motion in her neck. So even though the term arthritis literally means joint inflammation, it refers to a group of more than 100 rheumatic diseases and conditions that can cause pain, stiffness, and swelling in the joints. Certain conditions can affect other parts of the body, such as muscles, bones, and some internal organs, and can result in debilitating and sometimes life-threatening complications. If left undiagnosed and untreated, arthritis can cause irreversible damage to the joints. So, first of all, a brief description of osteoarthritis. As I've said before, it's the most common form of arthritis, and it affects millions of people worldwide. It occurs when the protective cartilage that cushions the ends of the bones wears down over time. And although osteoarthritis can damage any joint, the disorder most commonly affects joints in your hands, knees, hips, and spine. Osteoarthritis really develops before the age of 40, but it affects nearly everyone past the age of 60. Nearly 3 times as many women as men have it. Previously known as degenerative joint disease, osteoarthritis results from the wear and tear of life. Other risk factors include joint trauma, obesity, and repetitive joint use. With joint trauma, when I say that, it's of course because of sport or physical labor. Obesity causes a lot of pain and a lot of pressure on the hips and the knees and the spine. And repetitive joint use. So, very often golfers, they have a lot of trouble with their knees and their spine because of that repetitive movement that they have to make. It's just one example. Then we'll go on to rheumatoid arthritis. This is an autoimmune and inflammatory disease. It means that your immune system mistakenly attacks the synovium, which is the cell lining inside the joint. An overactive immune system can be just as harmful as a weak one. As with other autoimmune disorders, rheumatoid arthritis is a self-attacking self-disease. In this case, the body's immune system improperly identifies the synovial membrane as foreign. The synovium becomes inflamed and thickened. The inflammation damages the cartilage and tissues in and around the joints. And often the bone surfaces are destroyed as well because inflammation in the joint triggers the production of enzymes that slowly digest the adjacent tissues. The body replaces this damaged tissue with scar tissue, forcing normal spaces within the joints to become narrow and the bones to move closer together. So then it causes irreparable damage that will remain. Rheumatoid arthritis creates stiffness, swelling, fatigue, anemia, weight loss, fever, and often crippling pain. It frequently occurs in people under 40 years of age. The onset of rheumatoid arthritis is associated with physical or emotional stress, poor nutrition, and or bacterial infection. So it's not just one thing here. While osteoarthritis affects individual joints, rheumatoid arthritis affects some or all of the body's synovial joints and is often diagnosed by the finding of rheumatoid factors, which are antibodies, in the blood. Juvenile arthritis is a disease that I'm going to mention straight after rheumatoid arthritis because it is inflammation of the synovium in children aged 16 or younger. The synovium, as I've said before, is the tissue that lines the inside of the joint, and juvenile arthritis is an autoimmune disease. And so it is a form of rheumatoid arthritis, but sometimes it can just disappear of its own and doesn't necessarily stay to adulthood. Then we have gout, which is a common form of inflammatory arthritis, very painful, and it usually affects one joint at a time and often the big toe. A joint. My husband would always say that the gout is a drinking man's disorder because people who drank a lot of beer or wine often got gout, but it's since proved that that's not true. It is an inflammatory arthritis. So there are times when the symptoms get worse, and these are known as flares, and there's times when the symptoms just disappear, and these are known as remission. And so people who struggle with gout, it will come and go quite often. Then there's a form of arthritis called Reiter's syndrome, R-E-I-T-E-R, Reiter's syndrome. It produces pain, swelling, redness, and heat in the joints. It's one of the arthritic disorders that affects the spine, and it commonly involves the joints of the spine and the sacroiliac joint areas where the spine attaches to the pelvis. Then another one is reactive arthritis. This is a type of arthritis caused by infection. It may be caused by chlamydia, salmonella, or other infections. The condition may cause arthritis conditions such as joint pain and inflammation, but it may also cause symptoms in the urinary tract and the eyes. A couple of weeks ago, we did a short series on lupus, specifically the SLE. And as we learned, there's an inflammation of the joints that can happen with this disease, and it is called SLE arthritis. Sharon explained to us briefly how she struggles with the joint pain, which is, of course, the SLE arthritis. The last one that I want to mention today is psoriatic arthritis. Now, this is because several of our customers are struggling with it, and they would just like to know other people's ideas on it. Some people have been recently diagnosed, and there's others who've had it for many years. So it is a form of arthritis that affects people who have psoriasis. Different readings say anything from 5% to 30% of people who have psoriasis will develop psoriatic arthritis. So the psoriasis is a condition that features red patches of skin topped with silvery scales, and most people develop psoriasis first and are later diagnosed with psoriatic arthritis. But the joint problems can sometimes begin before skin patches appear, and skin patches may never appear. It may just show up in the blood as the psoriatic arthritis, or that they have psoriasis, but only the arthritis point part. Psoriatic arthritis is also like rheumatoid arthritis. About 5% of people with psoriasis can develop bad symptoms of the psoriatic arthritis. Fewer joints may be involved than with the rheumatoid arthritis, and there is no rheumatoid factors in the blood. So that's how the doctors know that it's not the rheumatoid. Next week, I've got the privilege of interviewing Sharon Chunilal. She's a friend of mine who has lived with psoriasis for more than 40 years. And she has agreed to tell her story because she has lived as naturally as possible with this debilitating arthritis. And she'll explain to us what has worked, what hasn't worked, when she's needed to see a doctor, and when the natural methods have been able to keep things under control. So she's a mine of information and so interesting to listen to. So I look forward to that for next week, and I hope you do too. So until next week, Chris and I wish you love, peace, and joy. Bye for now.